Alzheimer's disease. Everything new is forgotten old. From amyloid plaques to neuroinflammation and the integration of traditional knowledge. This is a journey from the new to the long-forgotten old. Alzheimer's disease has entered a new era of scientific understanding and clinical possibilities. But the recipes and herbs recommended by Jewish traditional medicine help maintain mental clarity during aging and into old age. Alzheimer's disease has entered a new era of scientific understanding and clinical opportunities. The shift in focus from the amyloid hypothesis to neuroinflammation has opened up prospects for the development of innovative drugs and multi-target strategies, while personalized medicine and early intervention are becoming the standard of the future. The integration of traditional knowledge, particularly Jewish traditional medicine, expands the therapeutic arsenal and allows for tailoring to the cultural and individual characteristics of patients. This comprehensive model of Alzheimer's disease management offers hope for slowing disease progression and improving quality of life in older adults. Alzheimer's disease is the leading cause of dementia in the elderly, representing one of the major medical and social challenges of our time. With an aging population, the prevalence of Alzheimer's disease is steadily increasing, imposing significant economic and emotional costs on society, patients, and their families. Despite intensive research, no effective therapy capable of halting or reversing the progression of the disease exists. In recent years, there has been a significant shift in our understanding of the pathogenesis of Alzheimer's disease, opening new horizons for therapy and prevention. Traditionally, the pathogenesis of Alzheimer's disease was associated with the accumulation of amyloid plaques, beta amyloid, and neurofibrillary tangles, hyperphosphorylated tau protein, which were considered the main drivers of neurodegeneration. However, numerous clinical trials of drugs targeting amyloid have shown limited efficacy, calling into question the amyloid hypothesis as the sole mechanism of the pathology. In recent years, increasing attention has been paid to the role of neuroinflammation, a chronically activated state of microglia and astrocytes that leads to the release of pro-inflammatory cytokines, oxidative stress, and disruption of neuronal homeostasis. Research has revealed that neuroinflammation can not only be a consequence but also an initiator of the pathological cascade, contributing to disease progression, disruption of synaptic transmission, and neuronal death. Thus, the pathogenesis of Alzheimer's disease is considered a complex multifactorial process, in which amyloid and tau pathologies, as well as neuroinflammatory mechanisms, are closely intertwined. The revision of pathogenetic concepts has stimulated the development of new therapeutic strategies. Among the innovative drugs, agents aimed at modulating the immune response, suppressing inflammatory processes, and protecting neurons from oxidative damage stand out. Repurposing existing drugs is another promising approach. Drugs previously used to treat other diseases, such as anti-inflammatory agents, COX-2 inhibitors, glucocorticoids, immunomodulators, and even some anti-diabetic drugs, metformin, are undergoing clinical trials as potential treatments for slowing the progression of Alzheimer's disease, especially in its early stages. Interest in integrating knowledge from traditional medical systems, particularly Jewish traditional medicine, JTM, is driven by the search for new sources of biologically active substances and approaches to treating Alzheimer's disease. JTM utilizes plants with neuroprotective, anti-inflammatory, and antioxidant properties that have not been used in other forms of treatment. For example, improving memory, relieving anxiety, and promoting overall health. Today, promising plants traditionally include myrtle, Myrtus communis, sage, Salvia officinalis, pomegranate, Punica granatum, olive leaf, Olea europea, and black cumin, Nigella sativa. Modern pharmacological research confirms their ability to reduce inflammation, improve cognitive function, and protect neurons from damage. The use of extracts of these plants as adjuvants for the correction of cognitive impairment in elderly patients is becoming a topic of interest in multi-target therapeutic strategies. But in the diaries of my ancestors, in recipes and stories recorded during expeditions to Jewish shtetls, they also mention plants that have been used since ancient times, particularly in Jewish traditional medicine, to prevent and treat memory loss and other age-related cognitive disorders. One of the most discussed advances in recent years has been the introduction of anti-amyloid monoclonal antibodies, e.g., aducanumab, lecanemab, for the treatment of AD. These drugs target and remove beta amyloid from the brain, which slows the progression of cognitive impairment, especially in the early stages of the disease. Clinical studies have shown that anti-amyloid antibodies can reduce amyloid levels and, in some cases, improve cognitive performance. However, their effectiveness remains moderate, and the range of side effects is significant: cerebral edema, microbleeds, headaches, allergic reactions. Therefore, interest is growing in multi-targeted strategies that simultaneously address several pathogenic factors: amyloid, tau, neuroinflammation, and oxidative stress. Such approaches involve the use of combinations of drugs, biologically active substances, and non-pharmacological methods, diet, physical activity, cognitive stimulation, which can increase efficacy and reduce the risk of side effects. Modern therapy for Alzheimer's disease is increasingly moving toward personalized medicine based on individual pathogenesis, genetic factors, comorbidities, and biomarkers. Determining a patient's pathogenetic profile using molecular diagnostics, neuroimaging, and biological fluid analysis enables the selection of an optimal therapeutic approach and interventions, minimizing risks and increasing treatment effectiveness. In Jewish traditional medicine, the seven-herb principle has supported this individualized approach since ancient times. This personalized approach combines multi-target strategies with early intervention and the integration of traditional knowledge, including the use of herbal remedies tailored to the patient's specific needs. Early detection and intervention for Alzheimer's disease are key factors in the success of treatment. Modern diagnostic methods, PET scanning, CSF analysis for amyloid and tau, genetic testing, enable detection of the disease in the preclinical and prodromal stages, when pathological changes are still reversible and therapy is most effective. The implementation of screening and preventive strategies, including lifestyle modifications and the rational use of medications and dietary supplements, can significantly slow the progression of cognitive impairment. Alzheimer's disease has entered a new era of scientific understanding and clinical possibilities. But the recipes and herbs recommended by Jewish traditional medicine can help maintain mental clarity throughout aging and into old age.